Hello. Under this mask here is Caleb Smith with the Rocket Miner newspaper, here to provide your regular coronavirus update for May 9th, 2020. Turning to figures from the Wyoming Department of Health, we've had 495 lab-confirmed cases of the coronavirus in Wyoming. When it comes to unconfirmed but probable cases, that number's at 158. And when it comes to recoveries, that number's at 443. So the good news is that right now, Wyoming, as in most places, people who are catching the virus are turning around and kicking it, getting back to their lives, which is great news. Wyoming death count remains unchanged, which is good. We've only had 7 people who have died contributed to the virus. Sweetwater County's numbers are also unchanged, but bear repeating. We've had 12 lab-confirmed cases, another 7 probable cases, and so 19. And then, when it comes to recovered figures, we've had 17 best the virus. So, 17 out of 19 is a high percentage, hoping for 100% in the near future. Turning to cases in the United States, according to the Centers for Disease Control and Prevention, we've had 1,274,036 cases total. That's an increase of 25,996 new cases compared to yesterday. When it comes to total deaths in the United States, that number's at 77,034 people who have died. And that's 1,557 new deaths compared to yesterday. Worldwide figures from Johns Hopkins University show that for total cases, that number is now at 4,023,218 cases. When it comes to the global death count, that number's at 279,303 cases. And when it comes to recoveries, that number's at 1,370,375. Let's talk about the mask a little bit. I'm sure if you've been watching, you're like, he doesn't normally wear a mask. Not in these videos. But if you've seen me out and about, you'll know that even if you're not my neighbors in the apartment, hi guys, you know that you usually see me in here with the mask. Whether it's this one, and I'll admit right now this is my favorite scarf. This is the outer layer, or something similar. I'm dutifully washing them on a regular basis too, as is one of the guidelines, keeping it flush against my face, cleaning it frequently, that type of stuff. And I'll admit, there have been, even when I'm out and about, I'm the minority. There have been some times when I'm the only one at a place wearing a mask, or certainly, if I'm in a supermarket, there might be some of the employees of the business who are wearing it, a couple other people in the aisles, but it's rare. And I am seeing so much online, and even some conversations I've had with people about what this mask says about people, what it indicates about them. And what I would like to do is that I'm going to tell you what this means to me. I don't wish to talk about what's going on for somebody else, wearing a mask, not wearing a mask. I'm not in their heads. So I can barely operate the rickety machinery in this brain. But let me just take a moment as we have a conversation here, to let me just tell those of you who are watching this video why I personally am wearing this mask, and the thought process that goes into it. I see this mask as a courtesy, as a kindness, as a consideration for the people around me. This isn't fear for my own circumstance. I hope it's, well, maybe not hope, but I think if you've been watching these videos, if you see the clothes that I wear, if you see how well I take care of myself, I think it's pretty obvious that I have been kind of rough on this human body. I'm not worried. I'm not taking as good a care of it as I should be. I'm not that worried about it. I'm personally not in that risk category when it comes to the stuff to be worrying about. So that's not really why I'm wearing that mask. And that's good, because the CDC stresses that it's not really that protective for the wearers, the people on this side of it. We're still trying to understand the virus. There are a lot of things, there's some big holes in our gap we're still trying to determine. But one of the things that the current research, as we presently understand it to the best of our knowledge, is that it doesn't really offer that much protection to the one who's wearing it, but proportionally it has much more protection for the people around them. Right now, this is a virus that a decent percentage of the people who catch it are asymptomatic for a number of days, meaning they don't realize they have it. Their symptoms may not be present. They may not have a noticeable fever or cough or pain in their chest or whatnot. They may never develop those symptoms, or you might be, some people in my family, they run a little bit hot anyway. They're used to being just a little bit over that average temperature. Or they're one of those type of people that they just push through the pain. They don't even take aspirin or ibuprofen or anything. They just head through the end of the day and crash hard when they get the chance. Now, this mask is because I could be out and about and I could have caught it, probably from somebody who didn't realize they had it either. And if I'm wearing a mask, my odds of passing it on to somebody else greatly reduce. It's even more so if both of us are wearing masks. Now, it's a pain, and it's frustrating. I came from the Midwest, Missouri. It's in some as it's known in some corners, and I feel like that I am back in the humid Mississippi River Valley, underneath here. That's part of it's, and that's part of my design. Even these simple facial coverings, not the medical grade stuff, even just having a scarf or those simple thinner ones, it contains the droplets, the stuff that gets aerosolized and up into the air. It gets trapped in here. It's that much worse when you have a big fluffy beard like I do. It protects other people for that, and that's because. And I would hate. If we are talking about something that I'm concerned about, like I said, it's not me. I am worried that I would be in a position where I'd have it, pass it to somebody else, and I tell them that I'm sorry, and they can't tell me that they forgive me because they have a ventilator down their lungs. They can't do it, and nothing's coming out. That is a very, very rare case, but it's out there. And it's something that I can lower the odds of that happening. I can't eliminate them, but I can lower the odds. And if I can do something on my end to do that better, I'm going to do so. It's not about just doing only what the government tells me to do, or what the New World Order is trying to cow me into doing stuff. This is about me wanting to be a good neighbor, to be a good friend, to be a good son. Personally, like I think most people, I'm trying to be a better person. I know I got a lot of work on, and this is one step that I'm taking to get to that point. And this is just for me. There are other people who they have different actions, and even the CDC notes that if you they discourage a mask if you're under 2 years old, or if you already have somebody who has difficulty breathing, or heaven forbid, and this is extreme cases, most of us won't see that. If you have a mask on, and if a person has a mask on and they're unconscious, incapacitated, or otherwise unable to remove their mask around assistance, just in this case, that's loosen it up a little bit. And like I said, there might be people where they had a mask and it got toots. It came off. I usually have 2 layers, so sometimes I've I keep losing scarves. This is something why my family keeps sending me them. I have the lower level, the layer I usually have beneath it still there, but I've lost the scarf. Or maybe if it's one of those ones, rubber band ones, maybe it snapped one too many times. You can't tie it up. They're normally wearing a mask, but they don't have one right now. Or they have a limited supply. Or they just forgot. And there's once or twice where I've been 2/3 the way to the dumpster out back and went, oh, you're not living up to the example you're asking other people to do. You got to work on that. This thing sucks. I don't like it. The little bit of color helps, but it's an inconvenience. Not just physically, with feeling like I'm back in the Mississippi River Valley with none of the benefits. I mean, it's different if I'm back close home to friends, family, fresh catfish. That's different. This is all the mugginess with none of the extra fun that I've come to associate with that. It's harder to breathe. I look forward to when I can get back into my car and pull this thing off. But I'm still dedicated to wearing it. I recently had a friend who had some yard work that needed to be done. Posts pulled, concrete poured, poles put back in. And I wore this the whole afternoon because I was dedicated to being helpful and lending a hand. And still practicing that distancing. And this thing made that afternoon that much rougher for me. There's a reason why I'm now running around with, I usually have a bag of straws with me, because when it gets hot and sweaty, you're still not supposed to be taking this sucker off. And the one that right now is most forefront in my mind, and frequently is that we rely on the full face to communicate. I had a number of friends in college who were deaf, and they were especially concentrated on reading lips. And right now, I cannot, if they'd be watching this video, I cannot connect with them the same way that I would be before. There were a couple times this week where there was an awkward moment, and I try to flash my, hey, what can you do, smile? And I'm pausing because I'm going, you can't see the smile beneath the mask. I mean, I'm hoping that you maybe see a little bit of it at the corner of the eyes. I mean, I've gotten rid of most of the distractions. This is almost entirely gone. You only got so much to work with. But when it comes to connecting with a person, trying to have a shared moment, I am hindered because I am wearing this mask in this video and when I'm out in the public. As a person whose job at the newspaper, its communication is one of the #1 goals, is to be able to get something from other people and be able to relay it to a wider audience. Anything that gets in the way of communication is especially irritating. And we try to reduce that as much as we can. Whether that comes to paraphrasing awkward quotes, double-checking information, explanations, acronyms that aren't necessarily explained, jargon. This mask is hard. There are some of you who are having a harder time hearing me, understanding me. Not just in this video, but when I'm out interviewing people. I know that. My ability to deliver good stories is, I'm not 100% able to do that when I'm wearing this mask. But because of the potential of this risk. That's why all of our experts, that are even at the most recent governor's conference, the state health officer, Dr. Alexia Harris, was saying she cannot stress she cannot stress facial masks coverings enough. There's a lot of things about the virus that we can't control, that we don't understand. This is something that I can do, and so this is why I'm doing it, even when the probability is low. The metaphor that I keep coming back to is child safety seats. That's when you take this added time and trouble and headache to take care of people, not because you are 100% sure you're going to have an accident. Most people I know who have the safety suits, they have great driving records, or they don't drive like I know they can when the kid's in the back. They still know that there's the possibility that something beyond their control, an outside factor, something from beyond the environment they can control in the car, may unexpectedly, swiftly, uncontrollably interfere. And they would rather have every possible safety measure deployed and at the ready, so that should that happen, the danger is reduced as much as possible. That's the same logic I'm applying right here. That's me trying to be, like I said, kind, courteous, neighborly. I wear this mask because I care about you and the other people that are around us too. Like I said, this is for me personally. If you want to know what going on in other people's head, ask them. Please stop assuming. A lot of the headaches we have right now, and a lot of some of the disinformation that is honestly out there, is coming because we're making assumptions. We should ask a few more questions. Google a couple more articles that you see coming through, or sometimes just ask people, well, why did you say that? Where did you get that from? I think we'd a lot more be on the same page if we did that in general, coronavirus or no. That's one of my other goals that I'm working on, to be a better person too. And if you want to take that too, go for it. And if I see you out there, the other thing that I'm also sensitive of, because I am guilty of this as anybody else, is that some of it's Americanism, some of it's just being a human being. It's different when you're asked politely to consider maybe perhaps doing something. It's voluntary versus being told you will do this. I know there have been times where I've been on my way to do a assigned task or chore, and someone told me to do it, and then suddenly I'm not quite so sure I want to do that right now. We really don't want this to get to the point where things get required. There are some places in this world where it did get that bad. There are places in America where there are certain communities where things are scary right now. The more we do voluntarily here, the better we reduce the odds of that situation being repeated at our own doorsteps. So, I'm not telling you what to do, because I don't like it when people tell me what to do. But I'm asking you to please think about it. Just think about it. Please. Under this mask, it's still Caleb Smith with the Rocket Miner newspaper, wishing you a good day and a safe tomorrow.